Hello friends, this is me Zubair Ahmad and welcome to my channel Learn and Live MD once again. So as in my previous lecture I discussed about the colon, lung and cervical cancer uh, and today I am going to discuss with you about the remaining screening tests for the your USMLE exams, especially for the USMLE step 2 CK and USMLE step 3. Let's start with the breast cancer screening. So for the breast cancer screening, the new guidelines which came in April 2024 of the USPSTF recommends like every 2 year screening with the mammography for women age 40 to 74 years. But sometime in the questions, in USMLE exam questions, you will see like they will ask you about the genetic testing. So like they will give you history, like age of the patient, their family history or something, and they will ask you about the next step, and you will find the option like the genetic testing will be the correct. So that's why I will recommend you all to remember these indications for the genetic testing. So first, like if you have two first degree relatives with breast cancer and one of them has age less than 50. So like two first degree, one of them is age less than 50, you will think for the genetic testing for the patient. If three first or second degree relative, regardless of the age, like three patients in the family tree, like either they are first degree or second degree or in the mix, you will think of for the genetic testing. Or first or second degree relative with breast and ovarian cancer. If you are seeing like one patient and who is like for example her sister has breast and ovarian cancer both, you will think for the genetic testing for this patient. Or if like they have two sisters, one has a breast, one has a ovarian cancer, you will also think for the genetic testing for this patient. Or first degree with bilateral breast cancer. So usually cancer occurs like unilaterally, but if it's bilateral, you will think like it's something mutation or something. You will think for the genetic testing for the patient. Or in the family, if a male has breast cancer, you will think for the genetic testing also because the most common cause of male breast cancer is the genetic. Or if in the question they are giving you like Ashkenazi Jewish woman with any of their like relation, like first degree or second degree with the breast or ovarian cancer, you will think for the genetic testing. So these are the indications for genetic testing. I will recommend you all to remember these indications. Second is the BRCA mutation. Sometimes they usually like patient has already been diagnosed with the BRCA mutation and they will ask for you the screening of the breast cancer. So here the rules are different. Like normally we were doing at the age of 40 to 74, but if the patient has a BRCA mutation, we will start from the age of 25. If patient is between age of 25 and 29, we will do the annual breast mammogram, not the biannual. We will do here annual. And if age is greater than 30, we will go for the annual breast MRI and annual mammography. Let's do a question for the breast cancer. Like a 55-year-old woman is screened for breast cancer. She is healthy and has no breast symptom or family or personal history of cancer. Previous breast cancer screening demonstrated dense breast tissue and no other abnormalities. Menopause was at age 15 years and she is now perimenopausal. She gave birth to two children and maternal age is 20 and 26 years. Breast examination is normal. Which of the following is the most appropriate breast cancer screening test for this patient? Breast MRI, breast tomosynthesis, mammography, or ultrasonography? So most of you will be confused between two options like a breast MRI or mammography because of dense breast tissue. Actually, the option correct is C because we usually you will find like 50% of women with dense breast tissue. It doesn't mean you will go for any invasive like the more expensive test like the MRI. We usually follow the mammography if patient is at the average risk. Yes, if patient is at increased risk and they have dense tissue, then we will go for the MRI with mammography. Not only single the MRI, but MRI with mammography. But if patient is at average risk, we will go for the mammography. Next is abdominal aortic aneurysm. We usually screen men only and in between of who are in between age of 65 to 75 with the history of smoking or the family history. If they do not have any family history or they never smoked, we usually do not screen them. And the imaging of choice is the ultrasonography and we usually screen once. But If we screen and we got some findings like patient has abdominal aortic aneurysm, the management like is more like we have to repeat depending on the size of the abdominal aortic aneurysm. This is my favorite chart from the emboss. I will recommend you all to remember this full chart, because if you will remember this, you will never miss a question regarding the screening, treatment, and management of the abdominal aortic aneurysm. So, if you did the ultrasonography and your test is positive, what you will do? It depends upon the size. If it's less than 3, if it's 3 and 5.4, or it's greater than 5.4. If it's less than 3, so we divide it into two criteria. Like if it's more like less than 2.5, then no follow up. If it's between 2.5 to 2.9, we usually repeat ultrasound at 10 years of it, after 10 years, I mean. And if it's between 3 to 5.4, it's divided into three criteria. But before that, we usually control the blood pressure, the medication, and will encourage the patient for the smoking cessation. So if it's between 3 to 3.9, we repeat every 3 years. And if it's between 4 to 4.9, we usually repeat ultrasound at 1 year. And if we notice like more than 1 centimeter or equals to 1 centimeter in a year expansion, so we will go for the CT angiography and possibly the surgery. And if abdominal aortic aneurysm is 5 to 5.4, we usually repeat after 6 months. And if expansion is equals to or greater than 0.5 centimeter in 6 months, so we will think for surgery and we will go for the CT angio first. Or if the patient's abdominal aortic aneurysm is greater than 5.5 or equals to 5.5, we directly go for the abdominal aortic aneurysm repair. But before that, we have to do an obtain like CT angiography if patient doesn't have already because of procedure planning. Let's do a question. A 66-year-old man is evaluated following a screening for the abdominal aortic aneurysm. He is asymptomatic. He has 30 pack smoking history, quite 5 years ago. Recent lung cancer screening with low intensity CT scan was negative. He has no further medical problem. Kidney function is normal. Screening abdominal ultrasound shows 5.8 centimeter abdominal aortic aneurysm. High intensity atrial is initiated. Which of the following is the most appropriate next step in management? Abdominal CT angio, open surgical repair, endovascular aneurysm repair, ultrasonography in 6 to 12 months, or no follow-up. As I told you already, like if it's greater than or equal to 5.5, we will think for the abdominal aortic aneurysm. But before that, we have to do CT angiography. So here is 5.8, and we do not know like patient has the abdominal CT, abdominal pelvis CT angio is done or not. So the next step will be the CT angiography. So greater than 5.5, we need a surgical intervention, but obtain CT first to determine the exact location of the aneurysm, like if it's suprarenal, juxtarenal, or infrarenal for planning of repair. Choice of surgery depends on the age, location, comorbidities, and the ability to tolerate the surgery. So these features like choice of surgery is dependent on the patient's features. Next is osteoporosis. This is also commonly most tested topic in the USMLE step exams. So usually we screen women for the osteoporosis, and the USPSTF recommends routine screening for osteoporosis in women 65 and older. So women 65 and older, and there are some indications for who are whose age is less than 65. If the patients are smoker, patients are like in anorexia nervosa, or patient has history of premature ovarian failure, and we usually go for the DEXA scans. And how frequent is every 2 years? So women every 2 years, 65 and older, and with the DEXA scan. If less than 65 and with history of smoker, anorexia, or premature, we will do for the DEXA scan and every 2 years. Next is diabetes. So diabetes screening is done almost in the age of 35 to 70 years, and there are some criteria for the screening. We usually diagnose the patient who are overweight, like BMI equal to 25 or more than, like 30 or more than 30, and obese like 25, and history of hypertension like 135 over 80. and we usually screen them every 6 months. We have different type of tests like A1C, fasting blood glucose, oral glucose tolerance test, or random blood glucose. So if patients we are going for the HbA1c, the first test. It is the preferred test in non-fasting state, and we have some value like if test result is coming less than 5.7 is normal, 5.7 to 6.4 we will do it like it will be pre-diabetic, and if it's greater than 6.5 it's diabetic. Fasting blood glucose, we usually need 8 hours of fasting for this test, and the levels if the glucose is 70 to 100 is normal, 100 to 125 is pre-diabetic, and if it's greater than 125 or equal, so it will be diabetic. And the random blood glucose, if it's coming less than 140 is normal, 140 to 199 is pre-diabetic, and equals to or greater than 200 it will be diabetic. And one more, which is a more sensitive test, is it is oral glucose tolerance test, and we usually do this test two times, like once fasting, and we give like 75 gram of glucose loading, and after 2 hours we repeat this test. So if it's coming less than 140, it's normal. If it's coming like 140 to 199, it's pre-diabetic, and if it's coming to equals or greater than 200, so we will do like it will be diabetic. And if patient is asymptomatic and you are getting any of these tests as like positive test, so you have to repeat the same test on a different day. Let's do a question. A 66-year-old man presents for his annual general medical evaluation with no specific concern. He has history of systemic hypertension treated with amlodipine as well as hyperlipidemia managed with diet. He has 25 pack year history of cigarette smoking and quit 18 years ago. Blood pressure is 148 by 84, and his BMI is 30. His physical examination is otherwise unremarkable. Which of the following screening measurement or procedure is most appropriate for this patient? Bone densitometry, audiogram, chest radiograph, nuclear stress test, or measurement of glycated hemoglobin. So the patient age is like 66, and patient has hypertension, and BMI is like 30. So screening should be option E, like the measurement of HbA1c. CT chest radiograph, we usually do not do this because the patient has 25 PhD, but he quit smoking 18 years, so it's more than 15 years. We exclude this option that way. So the correct option is E, because of age, BMI, and patient history of hypertension. We have a few other screening like hypertension. We usually do it every 2 year screening. Anyone who is greater than 18 years of age. And hyperlipidemia is divided in three major criteria. Like if they are men, we usually do it in from age of 20, like 20 to 45. We usually repeat it every 5 year, and 45 to 65 every 1 to 2 year, and greater than 65 we usually repeat it every year. If it's women, then they have increased risk after menopause, but we start from the age of 20. So common like hyperlipidemia is seen at age of 20, but these how frequent, that depends upon the gender and their age. So women 20 to 55 same 5 years, and 55 to 65 then we repeat every 1 to 2 years, and above 65 we every year repeat it every year. And diabetic, if patient is diabetic, we usually do for the hyperlipidemia screening every year regardless of the age and gender of the patient. And one more, like the HIV screening is usually we do it once in between age 15 to 65. And if a patient, also we usually do that in the pregnant patients too. Let's do a question. Like a 42-year-old woman present for routine follow-up, she takes no medication, she does not smoke, and has no known family history of hyperlipidemia. BMI of 28.8, blood pressure 129 over 83, heart rate is 88. Physical examination is normal. In recast lipid panel from 2 years ago was normal. Assuming this patient's health remains unchanged, when should her lipid levels be measured? It should be now, 1 year from now, 3 years from now, or when she becomes postmenopausal. So as I told you already, the indication, it depends upon, we usually start from the age of 20, but the frequency depends upon the age and the gender. So if it's women and age in between 20 to 55, so every 5 years. So this patient is like woman age 42, so it should be every 5 years. So this was done like lipid panel 2 years ago. So now we have to repeat after 3 years, not now. So the answer should be C, like women 20 to 55 every 5 years. And thank